11 in both. Because the other thing you're always concerned about when you see a lot of myopia is there some glaucoma going on there, But his corneal diameters are good and pretty symmetrical. And the other thing you look at is you look at the nerve. You know, if the nerve looks good, then you're in good shape.
Ok, tôi sẽ gọi nói chuyện với chị Loan ha. Chị cứ cho cháu về rồi tiếp tục chăm sóc như bình thường ha. Sẽ liên lạc với chị Loan sau. Ok.
So then as she comes along like this, she doesn't go past midline there. So the question is, do you do something or do you do nothing? First,
actually, her vision is actually pretty good as far as so I guess, do you decide when the head turn is too
right?
Too much?
It's you know, is this causing amblyopia? Is the head turn too cumbersome? So basically, if they're holding their head like that, and the vision is equal in both eyes, and they're binocular, and it's like, you know, maybe 10 degrees. I don't do anything about that, but she's a little bit more. She's, you know, she's a good 20, 30. And the problem is that when she starts to look the other way, she does this every once in a while, and it doesn't seem to bother her so much. You know, because usually the kids who are really binocular, they'll be
they're turning it.
Yeah.
Right now she can go to the middle.
Or if it comes
in,
right.
then we can do surgery to move it back to the center.
Okay, so at least something can be done if
it needs to be done. Nothing needs to be done now. She's doing a beautiful job of taking care of it herself.
So what does it cause? I mean,
it's a good question. Nobody really knows. It doesn't run in families, so it's not an inherited condition. It's not associated with anything that you did during your pregnancy. They know that the center of the nerve in the brain that, you know, sends the nerve out is formed abnormal in this condition. And
so that's not the muscle. It's not from the muscle.
It's not from the muscle. The muscles are actually normally formed. It's actually the headquarters for that particular nerve that powers that particular muscle isn't formed correctly